Hi, my name is Patricia Elam. I'm a graduate student in Northern Arizona State University. I'm working on my master's in public health with emphasis in nutrition, hopefully leading to becoming a registered dietitian and being able to sit for the registered dietitian exam at the end of my program in August of 2020. I was really interested in talking to everyone about the vitamin deficiencies post-bariatric surgery for bariatric patients and kind of understanding how post-surgery bariatric patients handle getting their nutrients in and the different things that kind of have to happen every day in order to make sure that we get it in our diets or that we're supplementing it. So first, I would really like to talk about the four main types of bariatric surgery. Bariatric surgery is a surgical weight loss, generally for obese or morbidly obese patients, and it can be used in children or in other people who are not considered obese, but this surgery sometimes can help with other chronic conditions or comorbidities that patients might have. So the four types of bariatric surgery that are most common would be the Roux-en-Y or gastric bypass, the gastric sleeve, gastric banding, or a duodenal switch. A Roux-en-Y or gastric bypass is the most restrictive. They surgically make the opening to the esophagus 10 millimeters in diameter, well 10 millimeters across in diameter. Then they take the stomach and say like it's a pouch. They cut it mostly out and they stitch up the side and make it about the size of an egg. And then you've got this other part of your stomach that they cut sort of free-flowing, but that part of the lower stomach actually holds the enzymes and nutrients that kind of help break down food and kind of help with the regulation of digestion in your intestines. The second most common would be the gastric sleeve, and basically again your stomach's like a pouch. They literally like cut it in half and they actually remove the bottom portion that has those gastric juices in it, and then they sew it up. And that is not as restrictive as the gastric bypass, but in both of these surgeries, both the gastric bypass and the gastric sleeve, they're taking 2 feet of the small intestines and surgically connecting it to the new stomach. And then that sort of helps with the new setup that you've got going on when you're eating. The third is the gastric banding or the lap band. And that's a little bit more invasive because what they do is they actually insert an instrument that goes over the top of your stomach and your esophagus, and you can control it from a little switch that they put under the skin. Usually it depends on your body, but they usually put it in a place that you're not going to be tapping it. And you actually control the restriction from the top of the esophagus to the stomach. You can make it wider or larger, which will help if you're trying to restrict it. It'll help weight loss, but again, that'll also, all of these surgeries sort of result in nutrient loss over time and daily. So the fourth one is probably the one you will not see that often, although if you watch shows like My 600 Pound Life or things like that, where you're seeing patients who are considered severely morbidly obese or usually over 350 pounds, this surgery basically takes it bypasses the kind of the intestines and it just goes right to the colon. So essentially what you're doing is you're eating, it's going through your esophagus, into your stomach, and basically just right to your colon. So everything is just getting washed out of you. This is kind of difficult for most people. They do lose a lot of weight quickly, which is why this is especially for morbidly obese patients. And they kind of have more nutrient loss because their food is not really staying in their system that long. And it causes other complications post-surgery that these other three that I've discussed don't have. All patients kind of go through different complications after surgery, but that one is definitely the one that is least common for just morbidly obese or obese patients with comorbidities. So those are the surgeries. I personally had a gastric bypass surgery in January 2016, lost about 160 pounds. After that surgery and before that surgery, I kind of went through some educational classes to kind of learn how I was going to need to live after surgery. The reason being is that you're not getting the nutrients you normally would through diet because you simply can't eat enough in a day to ensure that your intake is matching what your activity level is and things like that. So what I had to do is I had to learn to use resources and tools such as like MyFitnessPal and things like that that are available for free. You can use on your smartphone to kind of start logging what food I was getting. It also helped me kind of keep track of my sodium, potassium, and all that other good stuff. The reason being is that post-bariatric surgery, patients are more common to be severely deficient in things like B12, folate, zinc, iron, copper, calcium, and especially vitamin D. Most generally, people are kind of deficient in B12 and vitamin D on a regular basis, but having like a smaller stomach and not being able to eat a lot, you become even more deficient, and it actually can cause further complications like anemia and some other severe conditions if you're not able to balance it well over a period of time after having this any one of these weight loss surgeries, really. So I kind of wanted to go over the things that I have to take on a daily basis. So I am able to try to get as much as I can through my diet, but even 3 years out, I try to still limit my intake. I have 3 to 4 meals a day, and one of my staples is, well, I guess I probably can't have it on. It's called Optisource. It contains a lot of different fun vitamins, and I take this 4 times a day. And then I've got liquid B12 that I also take twice a day. I have biotin that I take once a day. I also have calcium citrate chewables that I also take once a day. I have Ultra D3 that I also take once a day. And I also have iron, and I take that once a day as well. When needed, I also take other metal supplements for like the zinc and the iron and the copper if needed, based on my blood tests. So I get my blood tests done at least once every 2 months, if not every month, because I just like to know where I'm at and see what I'm deficient in. And I think that that's common for a lot of bariatric patients who post-surgery need to kind of keep track of that so that we're not feeling sluggish or things like that. Because we have these enzymes in our stomachs normally that kind of help us break down food into our digestive system, and it pulls the nutrients from it. But after bariatric surgery, it's a lot harder because your stomach is smaller, you're eating smaller portions, and you really have to work harder to ensure that you meet your dietary needs every single day. I thought that these vitamins were a good representation to kind of show what a bariatric patient has to go through for the rest of their lives. And you really have to work hard to ensure that you're eating enough and making sure you're getting all the vitamins that you need, because it's very common to not get those vitamins. And as I mentioned earlier, there are complications you can get over time. Anemia is really high. You can also fall back into diabetes and things like that that are, some are autoimmune diseases and things like that that are really hard to come back from sometimes if you're not able to meet those dietary and nutritional goals after surgery. So I hope this has kind of just been an overall representation of what is necessary, because these surgeries definitely cut down the number of enzymes available both in your stomach and in your intestines that help generally break down that food and make sure that you're getting those nutrients in your body. And because you have a smaller stomach too, I think we tend to flush a lot more fluid faster, and so we're still not getting all of the nutrients we need from the food that we take in. So it's important to have all of these different and very interesting supplements. The bad thing is that you have to time them out. Like I cannot take the calcium citrate at the same time I take the iron, because they would sort of cancel each other out if I took them at the same time due to the absorption rates of these two vitamins. And it's just, it creates some complications because you have to know when to take what at what time, how many times per day. And it's a whole different lifestyle that you have to make permanent changes in order to be successful in. And I think that there are many people who don't keep up with that, or they miss vitamins and then they start feeling sluggish, and then you don't know what happens after that. So this was sort of a broad overview discussing the different deficiencies in vitamins. Again, that B12, folate, zinc, iron, copper, calcium, and vitamin D that most people can normally get through their daily diets or in supplements we have to take every single day, on top of trying to match that in our diets so that we are ensuring that we're getting the correct dietary needs and nutrition basically that we need as well. One other very important part of our diets is protein powder. Right after surgery, I had protein powder in everything. I couldn't eat regular food for about a month. I had soups, Jell-O, all kinds of interesting liquid diet things, and I was putting this powder in it just to maintain my protein because I wasn't able to eat regular food. So again, I still use this sometimes regularly when I realize I'm not meeting my own goals and needs with my nutrients on a regular basis. So it's good to have these things around just in case I need them. And as far as these vitamins, I use them every single day. If you have further questions or comments, I also have a nutritional and health blog specific to my own experiences through my bariatric surgery weight loss. And you can email me at plf28@nau.edu, and I would be happy to share any other information, especially regarding the vitamin deficiencies or bariatric surgery that you might have. I also mentor a support group and people who are going through the process, because it's often hard to find proper resources, and sometimes it's just nice to know that there's people out there who've been through this process that can both educate and help as much as possible. So please reach out if you have any questions, and I hope that this has been helpful. Thank you.